Why is whooping cough making a dangerous comeback in the US? Falling vaccination rates, waning immunity, and outdated tracking systems are fueling outbreaks from Texas to Florida. Young infants are most at risk. Former CDC immunization chief Dr. Demetre Daskalakis explained that pertussis cycles naturally with dropping immunity. But effective communication and vaccination can curb outbreaks and prevent severe outcomes, especially in kids who can't be vaccinated. In the early 1900s, whooping cough wreaked havoc among children. Now, DTaP and Tdap shots protect against it, but fewer toddlers are getting vaccinated post-COVID. Texas, for example, saw cases jump from 1,928 in 2024 to over 3,500 by 2025 as non-medical exemptions rise, notably after lawmakers eased exemption rules. Dallas County health officials report a decline in vaccination appointments, partly due to immigration fears, particularly among Hispanic families. Vaccines are key, but have limitations. The acellular switch in the 90s led to diminished long-term immunity, risking adult transmission to infants. Infants face dire risks, with 1 in 5 hospitalized and some developing pneumonia. PCR testing is identifying more cases now than ever, shedding light on this issue while true transmission is up. Worryingly, abroad, resistance to macrolide antibiotics used to treat pertussis is growing, though not yet prevalent in the US. The CDC is on alert, as international travel could introduce resistant strains. What can be done? Boost vaccine coverage and remind clinicians to suspect pertussis, especially in families with newborns. Obstetricians and pediatricians should emphasize Tdap and booster discussions. Nationwide, health advisories underscore the priority of vigilance. Dallas County is rebuilding outreach, but faces delayed immunization data access, complicating efforts. As holidays near, experts urge families with infants to ensure all are current with vaccines for pertussis, flu, COVID, and RSV, and to avoid sick visitors. Quick action is crucial if an infant experiences breathing difficulties. Protecting the youngest is a shared responsibility. As parents, staying informed and proactive is essential. Reach out to healthcare providers to understand the importance of vaccinations and discuss any concerns. Communities should come together to support public health measures that boost immunization rates. Encourage local leaders and schools to promote vaccine awareness by hosting informational events. Educate caregivers on the signs of whooping cough, like prolonged coughing fits and the signature whoop. Pausing to track vaccination updates can make a significant impact. With quick corrections, outbreaks can be mitigated, protecting vulnerable populations. Remember, every vaccination counts. Empower your community by spreading the word. By prioritizing health and safety, we can safeguard future generations and diminish the threat of whooping cough once more.
Everyone plays a role in forging a healthier tomorrow. Let's step up, stay informed, and keep pertussis at bay.